Costotransverse joints. Remember we said they kind of function similarly? And this is an accessory glide. So we're looking at glide. You remember we were showing some of the diagrams of these joints, how we were talking about the ribs kind of moving and gliding relative to those joints? Right? So that costotransverse, where the rib comes in and articulates with the transverse process. And then remember the head of the rib comes into the costovertebral. Right? So we're looking at both of those joints really collectively, the CV and the CT joints. Okay? So effectively what we're doing is we're going to block the transverse process, and we're going to move the rib directly on that. So when you look at this taking place, I'm going to block with my thumb, okay, in the first instance when I'm trying to move the rib upward. I'm going to kind of put that block on the transverse process on top of that transverse process, and my other thumb is going to kind of be, you know, in line with my first thumb, but slightly off center, and that's going to be on the rib. So what I'm trying to do is I'm trying to move that rib upward on the blocked transverse process. Right? So I'm kind of holding that transverse process and I'm moving this rib upward on the blocked process. If I don't block that transverse process and I just push on the rib, the vertebrae and everything is moving. So I want to block it and push. So my fingers are literally like this. So think about it. This is blocking the transverse process, and this is pushing the rib up. That's all it is. Level to level. Now, when would I use this? Would I go every level? Oh my gosh, I would be there forever, right? That would take me 2 days to do that eval. I'm doing this on the patient that I already found the spot. I move them and, oh, that hurts. Okay, let's go into that spot. I put a pen on it, and let's see if that rib is coming up and how that's working and whether that causes symptoms. And then the other way we can do it is we can bring the rib down. So I might then come alongside that rib and block on the underside, rather, of the transverse process. So I might block on the underside of that transverse process. And then with my other thumb, I'm going to push that rib, let's go with this one, I'm going to push that rib downward. So again, same kind of finger position, they're both aligned. Now I'm blocking the transverse, and I'm taking that rib, and I'm pushing that rib down. So one's moving, one is just staying put. One's blocking, one's moving. If I just push on the rib, which I can do, I can just push on ribs here. I might elicit symptoms, and that's fine. And sometimes I do that with a patient. I'll come on and I'll just mobilize ribs and see what goes on with that. But if I block it and push, it gives me a more specific sense of what's going on at that CT-CV joint. All right, so you guys, I don't pretend you're going to be able to see this, but on the video, I think we got that pretty good. So check that out. One finger's blocking, one's pushing down. Okay? Now it's hard in here because you have thoracic kyphosis and you're trying to get in there and it's hard to feel what's the rib and what's the transverse. The transverse is right off of that spinous. So you feel the spinous and drop right off of it, and then you're blocking on the underside or on the upper side of that. And then your other finger is on that same rib. So you follow that transverse process out, so you're actually on the rib, come on the top of it, push down, come on the bottom of it, push up. Okay, so you're doing a little of this, doing a little of this, a little of that, a little of that. Okay? Trying to elicit symptoms. Okay?